think I'm going to go ahead and kick us off. And if other students or alumni join along the way, that is totally okay. So those of you who are here, my name is Tracy Shinell, and I'm an advisor at the Career Center. I'm a pre-health advisor as well as a general career advisor. And I'm so happy to see you all's names on the screen, and glad that you've taken time out of your schedule to be here today. I really believe that when you leave this session that you'll have a lot of great information that will help you with figuring out if this particular profession is a good fit for you. So in terms of the format, what it will look like is that I will be asking Tracy a series of questions. And at the end of my question asking, I'm going to turn it over to you all. And at that time, if you want to type something into the chat or even show your face and raise your hand and ask your question that way, that will be totally fine. I'm pretty flexible with the question asking. So with that said, I'm going to go ahead and get started with my first question. So Tracy, could you tell us a little bit about your career and educational background?
Sure. So again, my name is Tracy Shinell, and you probably already figured out that I am related to April. I am her sister-in-law. I am a registered nurse. I've also completed my graduate and undergraduate degrees in the nursing program. I started off in the nursing program as a second career in the early 90s. I have worked on the clinical side, and now I am now presently working on the non-clinical side of the nursing career.
Okay. And can you talk a little bit about the educational requirements to be a nurse? And also, in your opinion, what qualities are admissions committees looking for in candidates?
The prereqs, there's quite a few prereqs that are required when you start to pursue the health career field. Sociology is one, psychology. You have to have some classes in biology and chemistry, A&P, nutrition, ethics, of course, coupled with additional nursing theory classes some multiple nursing classes that you may have to sign up for and also complete on your trek to being a nurse. I took a kind of a non-traditional pathway only because that when I attempted to apply for the nursing program, they had a 5-year waiting list at the time. And in my mind, I'm saying, I don't have 5 years to wait to be on a waiting list. So I went through a licensed practical nurse program, and it took me about 1.5 years to 2 years to complete that. And from there, I started building those pathways and those stepping ladders to become an RN.
And what exactly is an RN, and how does that fit into like a bachelor's degree in nursing and having a master's in nursing?
So RN is a registered nurse. Registered nurses, you get a lot of your experience, and the beginning of your experience should start, and it's a requirement that you start on the clinical side. So on the clinical side of nursing, you can choose almost any pathway you want to go, from working in pulmonology, cardiology, working on a telemetry step-down unit or telemetry, working in oncology, med-surg, rehab. So there's different levels of experience that you may need. It's, when you start to go on that path to nursing, it's always good to have a well-rounded experience when it comes to nursing, though. That will help you further your future in the health career, if that's what you choose to do. And also, it can help you build pathways to a different level of nursing. So you don't have to feel like you're stuck in just one particular area, a specialized field of nursing. You will be able to explore and go into any direction that you feel a desire to do, or you feel that that's something that you would love to pursue when it comes to that field.
Okay. And you mentioned some of the coursework that you'll need to get into nursing school. You mentioned a number of science classes, but then also sociology, psychology classes. Aside from that, what do you think admissions committees are looking for in candidates? And in terms of other skills that they might bring, is it compassion, empathy, that you've done certain volunteer work? What are those qualities they're seeking?
Yes, of course, those qualities, well, first, initially, they want to make sure that you have completed your nursing programs, of the requirements of all that. That's part of the program as a whole. They also, yes, they're looking for people who want to be in a field where you're helping people. So it's not a lucrative field, of course, and you're not going to make a whole lot of money. So if that's your goal in life is to make a lot of money, this is probably not the career path for you. But you do want to, feel like you want to help someone in the community, people that you meet. You meet people of all walks of life when you're working in the healthcare field. Being caring, being compassionate, willing to go that extra mile to help and support and encourage not only the patient, but also the family, being an advocate for them and their family as well, people that's already involved in our healthcare. Trying to think, like I said, as far as the admission is concerned, that's pretty much what they're looking for. And, and your hopes are that somebody out there will give you the opportunity or the chance to prove yourself, that you can absolutely be that person that they anticipate or expect you to be, as far as taking care of the patients. And I'm being a very good nurse, an excellent nurse.
Okay. Well, you talked about the educational requirements. Could you talk a little bit about what it was like to be in nursing school? What were the things that you experienced that were most useful? What were the things that were most challenging?
So the most challenging thing, the most challenging part in nursing school is that you feel like you don't have a life, because you're in school all day, every day, whether you're in class for theory classes or you're on the clinical site. You go home after school and you have to study. There's little or no time for pleasure seeking or entertainment. You have to really have a strong support system as well. My husband was very supportive, and he was a most integral part of my career, and he helped me to make those other career choices in my life. And without him, I don't think I would have been able to make it. But I had witnessed a lot of my classmates. They started out the classes and schooling with their mates, but it ended up in separations or divorce a lot of times. But studying, like I said, is you have to be disciplined, and you have to realize that the importance of this, and then you have to determine how important it is to you to complete these classes. We had regular pop quizzes, and we had a lot of tests every few weeks, and I would maybe have multiple tests and multiple classes in the same week, and you have to prepare your mind set for that as well. Writing many papers involved in group projects, presenting presentations and PowerPoints, making posters, going out there into the community as being one of your clinical, one of the things you had to do, one of the things you had to do as far as achieving your clinical hours were doing maybe some community work or being assigned to some community place, such as a clinic setting, Planned Parenthood, things of that, the WIC office, things of that sort, just to get that kind of exposure to help you with completing your clinical hours with the nursing program.
Okay. What do you wish you had known before you applied to nursing school and entered this profession?
One of the things I believe I wish I would have known was that I wish I would have pursued, or I would have researched other nursing schools. I probably would not have taken the route that I initially had taken at the time. The other thing is, I probably would have did it. I would have probably completed this or pursued this earlier in life. But for the most part, I think, I mean, I have no regrets. I really don't. Like I said, it's a career that I chose. I chose it. It didn't choose me. It makes me, you know, I feel very confident in when I'm speaking to potential students, people who are maybe considering taking that path or any path in the healthcare field as far as that matter goes. Being educated, being able to not only educate my patient, but the family members as well as the doctors and other interdisciplinary people on the care team. I feel confident when I do so, as well as the patient themselves. And everything that I've learned in nursing school has been very useful in my career. Everything. I use multiple. I utilize multiple things in my career on a day-to-day basis based on what I was taught while I was in nursing school. So none of it was futile at that point.
Okay. You said you wish you had explored additional nursing schools. How do you think that that would have benefited you? And are there vast differences between different nursing schools?
There's on the junior college level, at the time, junior college level of nursing. So when you complete their program, you come out, at the time you came out with an associate's. They have now just kind of dissolved their program. The other nursing programs would be like those that were just, that stood alone. Like we had Barnes School of Nursing, we had Jewish School of Nursing, we had DePaul Hospital had their own, also own School of Nursing. May have been a little more, it may have been more expensive. I'll put it that way. There's other prereqs I may have decided to take. I would have taken it on a junior level versus taking it on a university or a nurse or a college level due to it may have been more cost effective to do it that way. Instead of trying to take a lot of prereqs and take them and couple them with the nursing classes that you had to complete in order to complete the nursing program.
Okay, so we talked a lot about your educational background and you know, what you wish you had known before you started school. Let's get into the day-to-day experience of being a nurse and what that's like. And I know you've had experiences on both the clinical and in the non-clinical setting. When the students signed up, I think they read information about your background, but if you could begin by reminding them about the different specialties that you've worked in, and then talk about the day-to-day experiences on the non-clinical side versus the clinical side.
Okay. So I've always felt, and it's very important to know that even if you decide that you want to pursue a non-clinical side of the nursing field, you have to get the exposure and experience you need on the clinical side. That's part of being well-rounded and building those foundations into your nursing career. Initially, when I began nursing, my career in nursing, I started off working in a skilled nursing facility in a nursing home setting. So the skilled nursing facility means that you had patients that you had to maybe start IVs on, or you had to do certain procedures like a nasogastric tube where you had to insert it, giving them IV medications, drawing labs and things like that, assessing them on a regular basis, documenting, following up with the doctors about the patients, about their progress and things like that, and also keeping the families in the loop and making them aware of what's going on. Receiving report from the nurse that's leaving, that's going off, and you're the oncoming nurse, making sure that you prioritize your day. Sometimes, you know, you have sick, all your patients are sick, of course, because they're there, but you have to prioritize your day based on, like, what's going on with this patient right now, or what's going on with this patient today. If this patient is scheduled for a particular procedure or a particular surgery, making sure that patient is prepped, everything was taken care of, all the doctor's orders were filled and completed before this patient has to leave the floor for whatever is going on with them. Something else I wanted to, making sure that you're prompt, that you're involved in the patient's care planning, that you're also involved in their discharge planning, because a lot of your input is going to determine the next level of care for that patient, and how well that they respond to the treatment plan that's been put in place for them. And when you have you have concerns about that, then the best thing to do is you always ask. You're not really sure of what's going on, you ask your superior, and even going back to talk to the doctor. So we did it's a lot that goes into taking care of those patients on the floor on the clinical side. The non-clinical side. So I do a lot of computer work now because I'm on the non-clinical side. I am a case manager, a registered nurse case manager, that is. And I work on the inpatient clinical side, so my concentration is on those patients that's already in the hospital. So I'm constantly reviewing their charts. They're being updated throughout the day. You do it on the daily and regular basis. I'm assigned a certain amount of patients. Sometimes I carry a load of 20 to 26 patients on my caseload. I meet with the doctors, and we do medical doctor rounds twice a day. We present our cases with the doctors, and they make the determination of, when they think this patient may be ready for discharge, or they're in agreement with what I, as the case manager, present to them, what would be the next level of care. So when I speak about what may be the next level of care, may means, so a patient came into the hospital, say that when they were admitted, they were very weak. They were emaciated because they hadn't been eating properly, nutritionally poor, don't have a lot of support at home, can barely take care of their daily needs. So we put a plan in place, a care plan in place. We may have physical therapy, occupational therapy involved. The dietitian will be involved in this patient's care plan. Nutritionist, clinical nutritionist may be involved in this patient's care plan, in addition to the doctors and other additional specialized care the patient may need. Physical therapy, occupational therapy will determine whether that patient is safe enough to return home, or if the patient needs to continue on to the next level of care at a rehabilitation center to get them back to their baseline before they discharge, in order for it to be a safe discharge for this patient. We meet with the patients, the families. We also stage family meetings with patients who need somebody else to speak in their behalf, or they just want their families there present at the meetings, or maybe their families are primarily involved in taking care of the patient. So we do a lot of, like I said, discharge planning, making appointments for patients, making sure that they have a follow-up appointment with their primary doctor before they leave the hospital. Make sure the medications are in place, or they can afford their medications. If they can't afford their medications, then we also have our social worker that's also involved in our patients. Every patient when they're in a hospital to sign a case manager and a social worker, whether they feel they need them or not. Communicating back and forth with the insurance companies, making sure that we submit the proper paperwork in order to get these patients approved if they need to go to a different level of care before returning home. And attempting to prevent the patient from being a readmission. So all of these play a very important part. It's a holistic part of the patient's life before they're discharged out of the hospital.
You gave a really great description of what you did when you were working within a skilled nursing environment. Talk a little bit about what you did in other specialties. Was there any difference between what you did in that skilled nursing facility? Were there any differences between when you worked with skilled nursing versus oncology versus other specialty areas, or are you typically doing some of the same things?
So you typically are, basically, like I said, your concentration is on your assigned patients, their medical condition, their history at hand, their medications, prioritizing your day, like which patients are your sickest, which ones are maybe scheduled for some type of test or procedure that they're coming to get them and they're going to take them off the floor for that. You basically start off your day the same, no matter what specialized field that you're in. Your concentration is just different. So I worked on the cardiac floor, the heart floor. And so your patients, or their main primary health ailment or condition at the time it has something to do with what's going on with their heart. I have had patients who have had open heart surgery, those who have rhythm problems with their heart rhythm and getting them, maintaining it or getting that under control. Patients who have what we call cardiac cath. I'm sorry if I'm using these medical terms and you don't understand. So a cardiac cath is a procedure that a cardiologist, a doctor who practices in the specializing of heart conditions, if a patient has had some irregular heart rhythms, or they do an echocardiogram on the patient and it's showing them that it's indicative of them having a heart attack. So they take this rod and they usually go in the groin area. They can also go through the fold, the mid fold of the arm, or they can go in the wrist. And they take this guide wire as they're looking on the screen to see if this patient has some major blockages or some arteries that are really narrow, where the blood flow is hard and difficult to get through. And they put this device in place to open those up so the patient may be able to go about their lives on a normal basis as they did before they ended up in the hospital. So it's, again, based on, what field that you're working in, what specialized field, it doesn't change the way that you approach your patients, or all approach on the same level. The same with my patients, my oncology patients. So oncology is the study of cancer patients. So on that floor, I had patients that I had to administer chemotherapy to, had patients that, you had to take care of their symptoms after their chemo care. You educate the patients and you talk to them about the importance of their nutrition, and talk to them about the importance of exercising and having different resources at their fingertips. So again, just based on what specialized field you desire to go into doesn't change the way that you approach your patients on a regular and daily basis.
Okay. So having worked on both the clinical and the non-clinical sides, what would you say are the rewards and challenges of both sides?
So the challenges are, like I said, it's communication. Communication is the key. Challenges are a lot is sometimes you feel like you're being attacked at times by the family or the patient when things don't go well. and you have to kind of take that as a grain of salt, and remember that the patients they're sick, they're frustrated, they have a lot of anxiety, they have a lot of fear of the unknown, and then you have to not take that personally, that you have to let them know that you're not there to attack them or to even counterattack what they may have said or done to you, but you're there to extend your services and to help them and support them in many ways or that you can, or in any way that you can, and also offer them assistance so they can better help and take care of themselves. I work in a hospital setting where I work at St. Mary's Hospital, and so the greatest part of our population is the poor and the underprivileged community. We got a lot of that inflow from after one of the other major hospitals closed. That was Deaconess. If you all are old enough to know that there was Deaconess, and then after that they changed it to Forest Park. Well, now it's just a vacant hospital that sits there. So now we get a lot of the influx of those patients that used to frequent that particular hospital. We get them now at St. Mary's, because we were just right up the highway from one another, not a half a mile apart, as a matter of fact. So it's very important that you educate these patients, trying to reinforce that with them and the family. You have a lot of patients that come in there, they don't have any insurance. They have no ways or means of taking care of themselves or taking care of being able to afford their medications. And this is where the social worker comes into play with the case manager as well. So we work together as a team to try to provide these resources that these patients need, and try to keep them under a doctor's care. We get them, we get them signed up into a clinic setting in a community near their hospital, so they can stay up under a doctor's care, and especially those who have some serious health issues.
Are there any common misconceptions or myths that people have about the nursing profession?
Again, I'm going to say, if you think, if you get into this field and you think that, you're going to get in it just to make a lot of money, if you're not happy, I've always said this, and I live by this, money can't buy happiness. And I don't care how much money you make, if you're not happy in what you're doing, then that's not going to be your resolution. That is a myth. I'm trying to think, what are some other misconceptions or myths that's out there? I can't think off the top of my head. I'm sorry, April, I'm drawing a blank.
Okay.
I really have not heard a lot of misconceptions, not unless the students may have heard some things that they want to discuss or talk about.
Okay, that's totally fine.
Now.
All right, so now I'm going to turn it over to the audience. If you have any questions, feel free to type them in the chat, or you can show your video, raise your hand, your physical hand, or raise the electronic hand, whatever works for you. I'm opening it up for you all to ask any questions that you have.
I had a question kind of related to like misconceptions. So I mean, a lot of people think that the physician will like take charge of like most of the medical decisions, which is for the most part I think true. But I mean, maybe not, but some people also think that nurses don't have as much of a role in like making medical decisions or important medical decisions. So I was wondering your thoughts on that and your experiences about.
Oh, okay. So absolutely, that is one of the misconceptions. So the doctors do play a pivotal role in the care and the planning of the care for the patient, or the treatment of care for the patient. But as you were saying, also nurses do too. And sometimes we may see things and we may recognize things that may have been oversight for the doctor. So it is our responsibility, again, as being not only an advocate for the patient, but also building those bridges with the doctor and the rest of the care team, and making them aware of certain things that may be going on. Maybe it was a lab value or something that the doctors missed. Maybe it was they were waiting for the results of a particular test and they had not seen it yet. And it's our, responsibility to say, hey, Dr. So-and-so, yes, that test is back, and this was the results of that particular test. So the doctors, they tend to listen to us when we give them insight and give them new information, put new alternatives out there on the table. They'll say, maybe, a lot of them will come forward and say, I didn't think about that, or I didn't realize this, and they can be in agreement with us. Sometimes, though, there are some, in certain situations where when you discuss the critical things, critical ailments or conditions of a patient with the doctors, and you're looking for a certain kind of response, you have to kind of lean in and make them feel that it was their choice, or they the ones that made the decision. You don't want to go ahead of them and make it appear that you're taking the lead or you're overstepping your boundaries. We still have boundaries and guidelines as case managers.
Thank you.
You're welcome.
Any other questions?
I have a question. I wanted to know, since you did say that money was not a big factor in you choosing nursing, what did lead you to choose nursing?
Being compassionate, Natalia, and helping people. I've always had that kind of spirit, even as a young person, volunteering my time with helping my family members, as being a caregiver in that manner as well. But I've always knew that whatever career path that I chose, it would be something that would be helpful and beneficial, and I'll be able to extend myself as far as helping others and making people feel that they're being taken care of, making them feel appreciated, that there's somebody else out there that cares, and doing all I can to make sure that all their needs are being met. Now, I can tell you this, Natalia, it's not a poor profession. I don't mean to put it to you like you can live comfortably as a nurse. I have lived comfortably, and I'm satisfied with my salary, the career, the experience that I have obtained through my profession.
Sounds like a wonderful career from what you've told me so far. I did have another question as well. What is your work environment like? I've heard a lot about how people say that nurses work long hours, they are very much on their feet. I just wanted to know a little bit more about your experience, because honestly, it's like you must enjoy it enough but despite all this, to work through that. So I just wanted to know a little more from your experience.
Yes, Natalia, again, it's gonna really be determined on which what type of nursing that you want to get involved with. Yes, to start off on the clinical side, in the hospital, they have their 12-hour shifts. And I think I've worked every shift invented by men. I've worked it. I've worked days, I've worked evenings, I've worked nights, I've worked the 12-hour shifts in the hospital, as I was saying. You either working 12-hour days or you're working 12-hour nights. And a lot of times, things happen that becomes a priority, maybe really close to the end of your shift, that you cannot leave for the other nurse, especially if it's something urgent and emergent. And sometimes your 12 turn over to 13 and 14 hours, not all the time, but sometimes based on what's happening or what took place. But if we do work long hours and you're up and down those halls and you're in and out of your patient's room, trying to make your presence known, making sure that you're anticipating their needs, every hour. You're in and out of those patients' room, making sure that they're okay, that they're not, you know, anticipating any needs for anything else, making sure, you know, for instance, that maybe you gave them a pain pill and then you're coming back an hour later just to reassess them to make sure that the pain pill is working. Maybe you gave them a sleeping pill and you're coming back in there an hour later to make sure that that sleeping pill was effective. And just, you know, watching their body language, and when you're doing this assessment will determine if you need to call the doctor to get something stronger, or to get something addition to what you gave them. So those kind of things play a part in your role as being on the floor. So you always got something going on. You're always busy. You're up and down the halls. And yes, those are some challenging hours when you're working 12-hour shifts in the hospital. Now, again, on the clinic setting or in the ambulatory setting, your hours are not that long, but you're still working. You're still pretty busy.
Thank you so much.
All right.
You're
Any other
welcome.
questions?
I had another question as well. So you said that you now are doing more work on the non-clinical side of things as a RN case manager, and I was wondering what made you shift over to more of that work rather than clinical work.
So, older, Niket, and you have to have forethought in your career path that you choose. So I already knew once at the bedside, it's heavy. Those patients are very heavy with not only their illnesses, but a lot of times because of their weight. So lifting and pulling and tugging on your patients and stuff, after a while, it will start to break your body down. You will start to deteriorate physically. You just can't do that as a long-standing part of your career. You have to start thinking in terms of taking other opening of the doorways or taking other pathways if nursing is your passion, but you need to do something else in that field. It was 35 plus years ago. You didn't see a lot of people overweight and obese, and now it's almost every person that you meet or you see, they're overweight, obese, coming and also presenting with a lot of underlying health issues, and then they come in families, and they're not just one person. It's not just a father or not just a mother. Sometimes you have families of patients that are in that situation or that predicament. So that was one of the things that started my wheels spinning, because I knew, and I had seen my coworkers and some of my friends that had been, one injury took them out of commission permanently from their career, what they did, which they made their living from, and they could not return because they ended up having, and like I said, serious injuries where it landed them in, hospital and surgeries and taking leaves of absence, and then to the point where they could not even return back to the unit, the floor, as a floor nurse, putting them out there early on disability and things like that.
I see. Thank you.
All right. Final call for any additional questions. Okay. Looks like there are none. Tracy, is there anything else you would like to say as parting words? What I really want you to take away from this, and I thank you so much, April, for asking me to come on to present this information to your students. But what I really want you to understand, and if anything, take away from this, is that whatever career goal that you decide to choose, I'm sure that you're going to be successful, whatever it is that you decide to choose. Be it a healthcare career or IT in computer engineering or something like that, or whatever else your heart desires. I feel you're going to be successful, and I thank you for allowing me to take this time to explain some of the things to you about the healthcare field from the nurse's perspective. And hopefully I've incited you on some things, maybe some things you didn't know, maybe some things that you perceive
I hope I was able to answer those questions for you as well.
All right, thank you so much. And thank you to the students who attended, and definitely attend more of these sessions that relate to your interest as the summer progresses, and continue to have a great summer.
Thank you.
Great, thank you.
Okay, thank you. Thanks, April.
Thank
Take
you.
care, everybody.